This is Dr. Eaves, and I am glad to share some knowledge with you on breast cancer. This is going to be a Q&A session, so I've already got the questions. Hopefully I can supply all the answers for you. Okay, one of the first questions I always get from patients is, how did I get this disease? It's a common question that most individuals will ask, and to tell you the truth, the only thing that we can tell you about particularly breast cancer, is that it does grow and it starts in the ducts of the breast. How and who gets it, we can't determine that unless the person has what's called the BRCA1 or the BRCA2 gene, which gives them a higher predisposition. However, what we do know is that if a young person develops breast cancer, or an older person, it's because the body no longer recognizes itself as self, and it starts to fight against it, and then you start to get a growth that knows no boundaries and then can spread. When we're talking about breast cancer, there are essentially 5 stages. The 5 stages include in situ, i.e. it's just inside the breast, maybe just inside the nipple, and it's not going to go anywhere. And those conditions are 100% safe. The worst case scenario is stage 5, in which the disease has spread outside the primary breast tissue and has gone to distant sites. For example, the liver, the lung, the bone, and the brain. Those are the main sites for what we call metastatic disease. Let's do symptoms based on age. Okay, if I have a person who's premenopausal, i.e. a young woman who is still menstruating, essentially they still have active glandular disease. So one of the things you're looking at that point in time is, how often, number one, do you do a breast exam? Self-exam is probably the key and critical issue in terms of defining a breast cancer. What if they find a lump in the breast, or they find some thickening of the tissue, or some irritation around the nipple? Those are some issues and concerns for breast cancer. So if you feel a lump that doesn't change from within 2 menstrual cycles, you want to have that evaluated by your primary care doctor or whoever you see. For women who are past menopause, the tissue begins to change from ductal to glandular tissue. So you have more fat and less lumpy bumpy. And for those individuals, it's a lot more easier to find because you're not looking at structural tissues changes. Because the breast has 2 types of tissues. It has smooth tissue and it has lumpy tissue. As we get older and we go through menopause, the lumpy tissue gets less and the smoother tissue or the fatty tissue becomes more. So it's easier to find in those individuals. But the same thing would apply. If you have a lump that doesn't disappear within a 2-month period of time, if you see redness or tenderness in the area, if you see discoloration of the skin, you need to have it evaluated by your doctor. Question. Because there are many options that we have, and it really depends on the size of the cancer. I always like to tell patients, if you can palpate a cancer that's 2.5 millimeters or centimeters in size, it's been present for 5 years, because it takes it just that long to grow. And a palpable 2.5 centimeter lesion depends on where it's located. If it's located on the outer side of the breast, even on the medial side of the breast, you can do a fine needle aspiration biopsy, because you need to first, number one, establish the diagnosis and make sure what it is. And the second piece after that, once you have the diagnosis of cancer, then the options are lumpectomy, simple mastectomy, modified radical mastectomy, straight for just radiation treatment, or chemotherapy, depending on the size, to shrink it down so that all the other things can be, all the other interventional steps can be taken. There's angiosarcoma, which is a rare type of breast cancer. From there you have ductal carcinoma in situ. That's something that's just located to the breast. Then you have stage 1 cancer, which is a mass that's less than 2 centimeters in size, that's localized and easily defined. You go to the next stage, which is going to be stage 2. It's a lump that is 2.5 centimeters to 3 centimeters in size. The higher up you go in terms of centimeter, and we look at the biggest size as being, quote, 5 centimeters in size, you already know that that's a mass that has dissected or spread beyond the breast tissue because it's there. The thing that you have to, that we don't talk about a lot, is whether or not the lesion is medial versus lateral. Most breast cancers are on the lateral side of the breast. So therefore you can do lymph node dissecting to determine whether or not it's spread beyond that. However, if it's on the medial side of the breast, it goes into the interthoracic lymph nodes, for which we cannot sample. Well, you know, that's such a loose term. And I say that anecdotally, because the things that you want to always do is a monthly breast exam. You do a monthly breast exam, you're actually going to know the architecture of your breast. And once you know your architecture of your breast, then if you feel something that's abnormal and is present through 2 menstrual cycles, it needs to be evaluated. If you know that you have a higher risk for breast cancer, i.e. your mother had breast cancer, her sister had breast cancer, your grandmother had breast cancer, then there's a high probability that you carry the BRCA1 or the BRCA2 gene, and your risk of developing cancer is extremely greater than the average population. For most individuals, there are some factors that are contributory but not diagnostic for developing breast cancer. And they had to do, if you're overweight, if your diet if you have a bad diet, all of these things change the immune status of the body, which can lead to other things down the line, including breast cancer. The second piece is if you feel a lump, you want to get some attention done right away. So prevention is breast exam every month, every single month, and then report.